Hello and welcome everybody. My name is Dr. Sophie Merrick and I'm a medical oncology registrar at UCLH, and I'm also a Cancer Research UK clinical research fellow here at the MRCCTU at UCL. And I'm going to give you an overview of my career path and my route to becoming a clinical trials research fellow. So I started my medical training straight after school. So I went to Manchester Medical School for 6 years. And I guess by a bit of a stroke of luck, I ended up on an oncology placement and met a fantastic team and really enjoyed working with them there. And during my medical school training, we had a block which was a research project, and as part of that I decided to go and work back with the oncology team at the Christie Hospital, which is a kind of leading cancer research hospital, and I looked at optimizing radiotherapy for prostate cancer, and that was my kind of first taste of clinical trials and research, and I really enjoyed it. After that I came down to London and started my kind of general medical training across medical and surgical and A&E specialties, and then I took a year to do something completely different, and I worked in clinical medical education at Kingston Hospital, which I really enjoyed. So after that, I went on to do more clinical training. So this is medical specialties, including things like intensive care and oncology. Decided I still really enjoyed oncology, and so I stayed on at Guy's and St Thomas's, and I worked as a clinical research fellow. And that was a job working at site, but involved in clinical trials, and I'll tell you a little bit more about that. After that, I went on to do my specialist oncology training, and that is, on a day-to-day basis, we do a lot of clinical research and clinical trials work. So it's kind of built into oncology as a specialty that we are doing research clinics, identifying, recruiting patients to trial, managing patients on trial. So that was kind of bread and butter of what I was doing. And then I secured a clinical trials fellowship with CRUK, and I started my PhD at the MRCCTU at UCL in 2021. I'm still doing that. And for those of you who have noticed that I've been in training and doing my PhD for a long time, that's because I have had 2 children in that time, so I had some time out, and then I've been doing some of this part-time as well. So just to give you a kind of idea of my job as a clinical research fellow, and I think there's lots of jobs like this around. So this was based at Guy's Cancer Centre, which is again a big cancer centre based in London. And my job here was really working patient facing. So identifying and recruiting patients to clinical trials across a wide range of oncology specialties, managing patients on the trial, responding to clinical queries, attending research meetings, thinking about things like the feasibility of setting up new clinical trials and whether they would work at the cancer centre, whether we had any competing trials. And I think that experience was really invaluable because it gave me an understanding of the practicalities of running clinical trials on the ground. And that was both academic and commercial clinical trials. So that was a really helpful kind of introduction to clinical trials for me. And then I did my specialty training, and then I started as a clinical trials research fellow here at the MRCCTU. And that was a completely different experience because that's not patient facing at all. And it's really looking essentially at how a trial is run and looking at how we run things from the CTU. And so my kind of role here was providing clinical input across multiple oncology trials. So a couple of those trials that I've been involved with recently are Refine and Rampart, which are both looking at immunotherapy treatment in kidney cancer. I've obviously got a close involvement in all the work looking at pharmacovigilance and safety. It's given me real insight into operational challenges, things like site setup, training, recruitment drives, dealing with challenges, and potentially thinking about, how you could redesign a trial or overcome those challenges. So, for example, Refine, when it opened, was looking at a particular treatment in standard of care and changing the way that we give that. But then a new standard of care was introduced. So it was how we're going to kind of deal with those changes, how we're going to amend the trial so that it can still run and is still answering an important question. It's given me the opportunity to lead multiple sub-studies. So you know, we often say learn what you can from every patient, and so, you know, you've got the primary outcome of the trial, but also thinking about these sub-studies. So for example, I'm running a translational sub-study within Refine, which is involving collaborations with lots of different labs, but also qualitative studies. So run that outside of clinical trials and within clinical trials. So for example, running that within Rampart at the moment, looking at quality of life of patients who've been on the trials. So that's been really interesting, kind of opened my eyes to, you know, more broadly what's involved in running clinical trials. Some of the other things that I've been involved with is discussions about trial design, conduct and analysis, leading collaborations with other institutions, which can sometimes be quite fun, like I'm going out to Washington soon to meet the team at the National Cancer Institute. So it's kind of really interesting speaking to world experts and just being able to you know, tap into that resource and learn from different people. One thing that I didn't really know much at all about before I started in clinical trials was everyone said PPI, and I didn't really know what that was or what that meant, but I started doing some PPI work when I started here and I really enjoyed it. So then I got more involved with the PPI working group, and that's been an aspect of clinical trials that I've loved because it's working with patients again, and I guess for clinicians that's often something that feels quite enjoyable to us, and working closely with kind of implementing changes and thinking of new research ideas. So I've really enjoyed that. Then protocol review committees. So one of the things that I've really enjoyed here is within the MRCCTU, we've got a big oncology department, but we also have a big infections and neurodegenerative sort of thread as well. And so recently one of the protocols that I reviewed was for a TB trial, and it was really nice to kind of work outside of my comfort zone because I think we can learn things from other specialties and other people's ways of doing things. So I really enjoyed that. And then education, so obviously the MSc in clinical trials, the MSc at STI in India, and also set up the NIHR Research Learning Lectures, which is a lecture series for clinicians who are interested in clinical work. And for those of you who haven't attended any of those yet, I encourage you to have a look at the website because they're all free, and they cover lots of interesting topics like balancing clinical work and academia and clinical trials, but it's all trials related. So just to give you an idea here, this is the kind of project that I've been working on recently, and I just wanted to give you an idea of how kind of broad ranging the work in clinical trials can be. So I'm interested in optimizing the way that we give immune checkpoint inhibitions, which is a treatment for cancer. And that, you know, I knew that it would involve a clinical trial and some trial design and some analysis of the data coming out of the trial. But actually it's been so much more than that. So I've done some qualitative research, and you know, we've formed a qualitative research group and we regularly contribute to each other's projects. I've been very involved in the patient and public involvement working group, which has been really interesting, and they've been involved in various different aspects of the projects. I've been involved with running the translational sub-study, which has involved international collaborations, and then getting involved with work on patient-reported outcomes, you know, pulling in specialists from different areas and internationally on that for advice and guidance as well. Thinking about things like operational challenges within the trial and how you overcome them, working on different kinds of statistical analyses. So it's been really broad-ranging and really interesting, and I love working with all different types of people on all of these different projects. So I guess this is probably obvious, but I just wanted to kind of highlight that if you're a clinician and you're interested in clinical trials, it's kind of the perfect combination, because clinicians have that, you know, practical knowledge of how things run on the ground, what's actually going to work, what is the patient pathway, what kind of issues can you foresee. And from a trials background, you've got all of the kind of knowledge of how the trials run, how the trials are designed, but also all of the, you know, knowledge that's perhaps like less exciting but really important, like about how regulations and all of the kind of legal frameworks we have to go with. So the combination of the two is really great, and it will help both components of your work make for an interesting career and interesting life, and also makes you a really valuable member of the team. So what do I love about a career in clinical trials? So I was trying to kind of think about what this was. And I think it's that life never gets boring. So you are mixing your clinical work and your clinical trials. So you're not doing endless clinics all day, every day, but you're really kind of staying up to date with what's on the ground, and at the forefront of kind of what changes are going on from an academic perspective. For me, oncology is a very research-driven specialty. So clinical trials work is directly relevant to oncology practice, which I really like. We're seeing these trials, we see the results come out, and then we're changing our clinical practice, and I think that's really exciting. I love working alongside international experts. I do love working alongside clinicians, but actually being able to work alongside non-clinicians is really valuable for me, because it's not something that I get in the hospital environment. So working with statisticians and methodologists, thinking about different ways of doing things. I love working with PPI reps who kind of challenge us sometimes to thinking about how we're going to run things, pharmacologists, other specialists, and even working, even when I am working with clinicians, I love the opportunity to work with not just oncologists, but other types of clinicians as well. I love the opportunity that, you can develop your own research ideas, and they don't always come off, but I love the idea that, you can come up with interesting questions and try and answer those. There's obviously some other perks as well, like being able to present your work, perhaps internationally, and the opportunity to publish papers, opportunity for collaborations, and I guess that with presenting the work can mean quite an exciting career and travel that perhaps just in the clinical world we wouldn't get. And it also allows for more flexible working than a purely clinical job. So I wouldn't say it's easier, because the pressures are always there, and you're then kind of juggling two types of career. But I would say that you're a little bit more in control of your own working hours and time, which having a young family has made a big change for me and helped a lot. So lots of advantages, and I definitely wouldn't change it. So where am I planning to go from here? So I would like to apply for a postdoctoral fellowship in clinical trials around the time that I finish this fellowship. Aim to be a chief investigator in clinical trialist in the future, and then maintain my clinical practice as a consultant oncologist. And also perhaps develop some of these other skills that I've learned through working in clinical trials, for example, continuing some of the qualitative research that we're doing across different areas, and thinking more about optimization trials and how to develop those. So thank you very much for listening. And if you've got any questions, then please do get in touch, and best of luck for your career in clinical trials.